Imagine your 8-year-old with ADHD, Emma, is excited for her school play. She's been practicing her lines every day. On performance day, she forgets her lines and hears some classmates giggling. Even though the laughter isn't about her, Emma feels deeply embarrassed and rejected. After the play, she runs to you in tears, convinced that she's a failure and vowing never to join any school activities again. Her rejection sensitivity is amplifying the perceived criticism, making the experience overwhelmingly painful. Hi, everyone. I'm Dr. Chris Akins, a licensed clinical psychologist and ADHD coach. I help parents of children with ADHD empower their kids to succeed at school, at home, and in life. And today, we're going to be talking about a topic that many people with ADHD struggle with: rejection sensitivity. Rejection sensitivity, or RS, is a condition where someone experiences intense emotional pain in response to perceived rejection or criticism. For kids with ADHD, this can lead to significant anxiety, stress, and even depression. RS often results in emotional outbursts, social avoidance, and harsh self-criticism. But why is rejection sensitivity so intense in ADHD? Remember, ADHD affects more than just attention and impulsivity. It also affects emotional regulation. This means that emotions can be more intense and harder to manage in kids with ADHD. So, when someone with ADHD experiences rejection or failure, it feels much more overwhelming and unbearable. To understand why RS is so intense in ADHD, we need to look at the brain. Research shows that RS is linked to abnormal activity in brain regions responsible for emotional processing, cognitive appraisal, and stress response. The neurotransmitter system, which also affects mood and emotional response, plays a critical role as well. Understanding that RS is a genuine neurological response helps us approach it with empathy and effective management strategies. Emma's reaction to forgetting her lines and hearing laughter is a perfect example of how RS affects kids with ADHD. Her intense emotional response isn't really about the mistake. It's amplified by her sensitivity to rejection. This makes the experience feel devastating and leads to avoidance behaviors, like refusing to participate in future school activities. Let's look at a few more examples. Take Alex, another child with ADHD. He's invited to a friend's birthday party. He's really excited to go to the party and make friends, but he feels ignored when trying to join a conversation at the party. This perceived rejection causes Alex to withdraw and avoid social situations in the future. Or Jordan, another child with ADHD, who receives constructive criticism from a teacher. Instead of seeing it as helpful feedback, Jordan feels demoralized and starts doubting her abilities, which affects her school performance. And finally, Sam, a college student with ADHD who gets a lower grade than expected on a term paper. He interprets this as a personal failure, leading to self-doubt and avoidance of academic challenges in the future. As a parent, what can you do to help your child? It can be disheartening and frustrating to see your child so devastated by perceived rejection. Here are some practical tips to help your child manage these strong emotions and build confidence. Tip number 1, learn to recognize the signs. Notice when your child is experiencing negative self-talk, feelings of anxiety, or physical tension. Notice when their mood or their behaviors change significantly for the worse. Tip number 2, encourage open communication. Talk to your child about their feelings and reassure them that it's okay to make mistakes. Use language that validates their emotions and helps them feel understood. Tip number 3, teach emotional regulation techniques. Practices like deep breathing, mindfulness, and positive self-talk can help your child manage their emotions. Techniques such as box breathing, distraction, and replacing negative thoughts with positive thoughts can also be very effective. Tip number 4, Seek professional help. Therapy, such as cognitive behavioral therapy or CBT, can help your child develop healthier thought patterns and coping strategies. CBT can teach children to challenge negative thoughts and replace them with more balanced perspectives. Tip number 5, build a supportive environment. Encourage your child to participate in activities they enjoy and provide a safe space for them to express their emotions. Positive reinforcement and celebrating even small successes can really boost their confidence. And tip number 6, role-playing and exposure therapy. Gradually exposing your child to situations they fear can help desensitize them to rejection and reduce its impact on their emotional well-being. And role-playing scenarios at home can also help them practice and build confidence. In addition to coping skills, we also want to build resilience in our kids with ADHD, so they are less vulnerable to RS. And here are some great strategies to help your child build resilience. The first strategy is to foster a growth mindset by teaching your child to view challenges and failures as opportunities to learn and grow. Praise their efforts rather than just their successes. You can also model healthy coping mechanisms by showing your child how you handle rejection and criticism in a healthy way. Your behavior can be a powerful example. You can promote social skills. For instance, by enrolling your child in programs or activities that teach social skills and help them practice interacting with others in a supportive environment. And finally, encouraging positive self-talk can help your child develop a habit of speaking kindly to themselves and challenging negative thoughts. So in conclusion, seeing your child struggle with reaction sensitivity can be tough, but understanding RS is the first step in helping them. By recognizing the signs and providing empathetic support, you can help your child navigate these intense emotions and build resilience. Remember, you're not alone, and there are strategies and resources available to you to help your child. If you found this video helpful, please like, subscribe, and hit the bell for notifications. Your support helps spread this valuable information to others who may need it, and it helps me understand what topics are of most interest to you. And if you are a parent of children with ADHD and would like to learn more about ADHD strategies that can help, please check out my free 60-minute online training. This link can be found below in the comments. Again, thank you for watching, and I look forward to seeing you again in the next video.